Early research into COVID-19 and pregnancy led some experts to suggest delivering via C-section and formula feeding newborns could help to reduce the risk of transmission from mom to baby. But a new study shows that's not the case. We're joined by CTV science and technology specialist Dan Riskin on this one. This is going to be alarming for some families and some households to hear. First of all, let's tell everyone the numbers. Researchers looked at 49 studies. This involved 666 newborn babies born to moms who had tested positive for COVID-19. So of the 292 babies born vaginally, only 8 tested positive for COVID-19. Of the 374 born via C-section, only 20 tested positive. So does this mean the method of delivery bears no relevance to potential transmission?
Yeah, I think this is something that, is a little bit of a silver lining on the COVID cloud. I think if you're an expecting mother or if you're an expecting grandparent and you've got a new baby on the way and you're worried about what might happen if mom gets sick right before delivery, people that were hitting the panic button and saying, get that baby away from mom as soon as possible. It just seems like that doesn't really have an effect. And the good news is that, even if the baby is born vaginally and then breastfeeds and is close to mom, all of those antibodies that she passes through her breast milk and just the health of babies in general and the resistance of young people to this disease mean that there's overall a very small chance that the baby is actually going to get this disease. So I think this is actually something that should give people a lot more of a sense of calm, especially if they've got a new baby coming, because that can be stressful to start with.
Absolutely, some peace of mind. The researchers also looked at whether the rate of transmission was affected by the method of feeding. You had mentioned this, as well as how close the newborn was allowed to get to mom. Those first moments are so precious between mom and baby, right? What did they find?
Yeah, and this ties back to what you and Ben have just been talking about, is that, we're doing all these isolation things, thinking we got to prevent the disease. But sometimes that isolation, especially for a developing child or a developing baby, can be as bad as anything else. And so here we have advice from doctors that, look, I know you're scared of this virus. I know, especially if mom's got the virus, you're worried about the baby. Put a mask on mom and then bring the baby close to mom and treat the baby the way you would normally and feed the baby the way you would normally. And you're probably going to be just fine. And the other little piece of this that came out of the study is that even in those cases where the baby does get this disease, COVID-19, they are remarkably resilient. They very, very rarely even show symptoms. And so it's an extension of that trend that young people don't get the disease as badly as old people. It seems that newborns are especially resilient. So if you're an expecting parent, this is just really, really good news that comes out of this study.
Dan, they then are looking for other causes? For example, if baby is contracting COVID-19 and they don't believe that it's either through birth or through feeding method, is it possible then that it's through hospital procedures, it's through medical staff?
Yeah, I mean, there's a lot of different ways that babies can get the disease, but the main thing is that when you've got somebody who has this disease and you're spending an extended period of time in the room with them, it's the breathing, it's the droplets. We know that there can be transmission of the virus through fecal transmission. So now there's talk of whether bathrooms need to be changed in order to prevent the spread. So it's not exactly clear exactly how in the birth process a baby picks up the virus, but I think the overall message here that you don't have to isolate the baby and put it away in a separate room away from mom and do all the negative things that happen to a baby as a result of that. You can just have the baby the way you want to have a baby normally. And just the way that humans are built and the way they resist disease and the way moms protect their babies with their immune systems and the extension of their immune system into the baby could have a huge benefit. It's quite possible that as the baby's developing, it's getting antibodies through the placenta that prevent it from getting sick in the first place. And breast milk is known to do that kind of thing as well. So moms, babies, the whole birth process works quite well as it is. And we don't need to do extra steps because they're not really having any effect.
That provides a lot of reinsurance for families, especially households having babies for the first time during this pandemic time. Dan, that's great news. Thanks so much.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.